we're also going to assess the bowel sounds and the GI functions, making sure that, the woman is not constipated. She's able to go to the bathroom. She's not having any abdominal distension and things like that. We want to assess the bladder function. We want to assess the intake and output, making sure that she's able to urinate frequently and urinating about 30 mLs an hour. Assess the locure for color, consistency, odor, which I talked about as well. Assessing the episiotomy site for edema, ecchymosis, eproxiation, assessing vital signs, and teaching her as well. If the lady has had a laceration or episiotomy, we want to instruct the client to always wash your hands thoroughly before and after voiding, using the peri bottle filled with warm aseptic solution after voiding to cleanse the perineal area to decrease infection. The client should clean her perineal area from front to back. We also want to let her know that she should blot dry and not wipe. We want to tell her to also assess her perineal pad and should be changed, and she should also change from front to back after voiding and assessing her peri pad frequently. We want to assess the cervix and vagina, making sure that the cervix is soft after birth, and the cervix can be bruised or have edema, which is common, and small lacerations. And we want to assess the vaginal discharge from the mucus, vaginal discharge, making sure that there's no smells or abnormal discharge from the vagina as well, making sure that her pelvic muscles are okay, and they can be overstretched or weak, which is normal after postpartum birth as well. And then on the clinical document, on the lab folder, it also says about REDA scale, REEDA. So that scale stands for, R stands for redness, E stands for edema, the other E stands for ecchymosis, D stands for discharge, and A stands for approximation. And that would also be assessed during the postpartum phase as well. So I pretty much talked about everything. Also assessing vital signs, making sure that she doesn't have temperature, her vitals, if it's over 100.4 or 38 Celsius, that can indicate some type of infection. We also want to make sure that she is dehydrated after, she may be dehydrated after birth, so we want to make sure that she has adequate hydration. Bless me. Bless me. If we're assessing the bladder function in the bubble scale, we want to make sure that she has an increased appetite after delivery and that she doesn't have any form of constipation. That also said, making sure that she doesn't have any spontaneous bowel movements, and if she does, that may occur 2 to 3 days after delivery. Bless me. We want to assess for fibroids and hemorrhoids as well. If she had any type of assistive devices during birth, we want to assess the bowel sounds as well, because she may be at risk for temporary postpartum or incontinence within 6 months after delivery. When we're assessing the urinary system, we want to make sure that she's not having pain with urination, that if she's having excessive urine or more than 3,000 mLs per day, this may be normal for the first 2 to 3 days after delivery. If she has a distended bladder, we want to encourage her to go to the bathroom. We want to assess the fundal height when she's having this distended bladder and making sure that she doesn't have excessive lochia, which can indicate postpartum hemorrhage as well. We want frequent voiding of less than 150 mLs of urine, can indicate urinary retention or overflow as well. If we're assessing the musculoskeletal system, we want to make sure that there's muscle tone in the abdomen, and we want to make sure that there's no changes, or if there is any changes in muscular system changes, we want to document that. We want to assess the abdominal wall and make sure that if there's a separation in between the rectus muscles, which can occur but will resolve within 6 weeks. So that's most likely the postpartum assessment, just focusing on the bubble and the Rita, making sure that, you know, we're assessing the fundus, like I said, assessing the lochia, and also assessing if she has to get the ROGAM 72 hours within 72 hours if she's RH negative and the baby's RH positive. Also assessing the cervix, like I said, making sure that it is firm and not boggy. And if we're assessing for bleeding, we want to make sure that we assess after episiotomy or lacerations. We want to assess the drainage, the quantity, and the frequency. If there is bright red bleeding, we notate that as a normal finding especially when she changes position and stuff like that and gets up. That's the early postpartum period that we usually have the bright red trickling of blood after episiotomy. And teaching her personal hygiene and how to wash her hands and clean her perineal area after postpartum period, and how to assess her perineal pad after delivery. And we also want to be making sure that we assess her perineal pad, you know, every hour or every 15 minutes if she's having excessive bleeding, to count how many pads she's going through within this postpartum phase. But the postpartum phase is pretty much, you know, during the fourth stage of pregnancy. We want to make sure that this is the recovery phase, and after the delivery of the placenta, and it includes at least the first 2 hours after birth, just making sure that all her vitals and pain relief is being, you know, assessed, and we're assessing for postpartum hemorrhaging and any deviations in any of her assessments. We want to document those and notify the healthcare provider.